the fibroblasts, the only role that they have is the hemostasis of extracellular matrix. The only way that we can stimulate them is two ways: injury and then biostimulation. As a biologist, I tell you that all of the parameters that put the skin in the danger of the stable aging signs, the same parameters, they put a danger to the skin cancers. So as a dermatologist, I tell to my patients, I'm a doctor. I'm responsible for the health of your skin. Beauty comes automatically after. I would like to alert you and your audience that vitamin C, if you put more, you transform the effect from an antioxidant activity to a pro-oxidant activity.
Welcome to Inside Aesthetics, the world's leading podcast for cosmetic practitioners and business owners.
Our podcasts are aimed at medical professionals and should not be used to make medical, legal, or financial decisions. You should get an appropriately tailored piece of advice from a professional in your country.
To show your support and stay up to date with our latest episodes, click the follow button if you're listening on Apple Podcasts or Spotify. And if you're watching our episodes on YouTube, hit the subscribe button as well as the bell icon.
If you're interested in joining our online community, being a guest on the podcast, or would like to work with us, all of our contact details are in the show notes. And now, let's jump into today's episode.
Hey guys, welcome to another episode of Inside Aesthetics, the world's most listened to podcast for injectors and cosmetic businesses. Now, David, it's our seventh podcast here at ICCE.
It's actually our last podcast for the event, so we've saved the best to last. And we're joined by Dr Ferial Fanian, who is a dermatologist based in Paris, in France.
Yeah, of course.
Before that, from Iran.
Yeah.
Yeah, thank you so much for joining us. Very much appreciate it.
You're welcome.
How have you enjoyed the event so far?
Wonderful, because I have been invited several times many years ago. I didn't accept, and from last year they put me in a board. So I was helping them also for organization, and I'm very happy because every year they have a very, very good growth.
Yeah. Now, before we jump into the episode, what are we going to be talking about?
Well, this is going to be one of our masterclasses. Dr. Fanian is an expert in skin, but also the topic of biostimulation. So we're going to try and delve into, we've covered it many times on the podcast.
I'm still confused by it, to be honest with you.
He's confused, I'm a little bit confused, but also there are so many products now, all making very similar claims, collagen this, collagen that. And we just want to pick your brain on some of the, minutiae of that. So thank you for joining us.
You're welcome.
And so you're a dermatologist, but you're much more than that. So tell us all about your background, who you are, just, get our audience familiar.
My background is like a crazy person because, to be a dermatologist is enough to work and to take money. I continue. So I have a PhD in molecular biology. 5 years work on the human cells. I was swimming between them. And then I have two subspecialties and fellowship in chronic wound healings. And also aesthetic dermatology. So it's because, the aesthetic dermatology, unfortunately these days, the people, they have only by experience and participating, the small courses. And this is not enough, really. So I had chance to have a 2 years, program in France from the beginning to the end, and now I help also the young and the beginners to have the same way.
Amazing. And you also have a big association with FilmEd. This isn't sponsored, so disclaimer, but what is your role with FilmEd?
Many years ago, in 2017, I was all of my life in a university in Iran and in France. But I have been invited by a company at that time. The name was Philoga, and then they changed to the FilmEd. It was the Philoga Medical, and then so I'm the chief medical and scientific officer of this company. It is not only this brand because it is a big group, cosmetic group in France that it regroup SVR, JF Lazartigue, Muscan Team. Also FilmEd and the Novoma as a supplementation.
Right.
Okay.
So they are a big group.
So what does that role actually mean? What do you do with that?
It's a good question. Normally the chief medical scientific officers in the companies, their role is to control and to guide all of the research, publications and development of the products. The development of the products, only for giving you some idea, it's in aesthetic, the shortest and easiest one is the cosmetic product that you use topically without an injection. So for this, normally we have only 1 year to development. The second level is the medical devices. And the medical devices, they are not the pharmaceutics products or medical products. So we should prove the mechanical effect of these products, like the injectables.
Yes.
For these products, we need around, for having, for example, CE mark, 5 years.
Yes.
And the medications like toxin, we need 10 years because it's phase 1, 2, 3, 4. So I'm responsible for all of this stepping of having a new products from the concept to the clinical trials and then to put it in the market.
Right. So you're doing all of that for PhilMed.
Yes.
And you also have a clinical practice. Do you still see patients?
Yes.
So what does a typical day or week look like for you?
You know, it is a little difficult because only I have my clinic, and I'm honored to have to buy with two of my colleagues, that is surgeon and also an ophthalmologist. One of the biggest, when I told you that biggest is not biggest by the size, it's the biggest by the, the quality.
Yeah.
One of the very, very famous doctors in France, he was the pioneer of aesthetic dermatology in France. And after retirement, she, decided to do the transfer to me. So only all of the day, normally the Monday morning, I'm in the hospital for the melanoma imaging. Then from Monday afternoon till Friday, I'm in a PhilMed, dedicated to PhilMed. And every Saturday, I'm in a clinic from 8 to 8.
Wow. Busy.
You're a busy
Very
woman.
busy.
And
Very
of course, you do lots of travel, conferences,
Yes, a
chairing,
lot.
research.
A lot.
Talk with people like us.
So the topic of the day, like we said at the start, was biostimulation. Now, let's just define what that word means, first of all, before we get into any detail. So what does it mean to you?
It is a very good question because it's, unfortunately, when I see my colleagues in their offices, they cannot categorize the products that they come to them. And every day is a list, a new visitors that they come to our office to present a new product that can stimulate the collagen. How we can use them? What is the difference between this and that? So I'm publishing an article in this categorization, and this categorization is like that. We have two big category of the products. The first is the biostimulators, and the second is cellular scaffold. The biostimulators, it means something that you put in beside the cells, and the cells, they started to be stimulated to do something. And this stimulation, normally, it should become from start with a inflammation, small inflammation. And this inflammation, if it's very big, the problem is normally we will have the complication of these products. So we should have a controlled inflammation. This is very important. And before going to this matter, because I go now my cascade of biologists, that the fibroblasts, they are the main cells of our skin in the deep layer of the skin. How long they can stay in our skin? 1 year, 2 years, 10 years, all of our life.
Right.
They stay with us, but they became inactive. And the only role that they have is the hemostasis of extracellular matrix.
Right.
So they are the old people in the society that they do nothing, but they eat everything. So the only way that we can stimulate them is two ways: injury and then biostimulation. So this injury, what is this injury? The wound, the trauma. When you have the active wounds, they started to be activated. But how long they stayed activated? Only some weeks. And they are the tendency to go back to the quiescent, phase for sleeping, lazy, like us. So the story is, by these biostimulators, we can stimulate them to be active. And this is not all of the story. They need also some equipments and tools in their hands. And later I will tell you what. So I come back to the biostimulators. So these biostimulators, we can divide them in 5 categories, big categories. First, liquid injectable one. You know them. The head of this category is HA.
Yes.
The second is all of the polylactic acid category, PLA, PLLA, PDLLA. We have the polycaprolactam, that it is also PCL, some products on the market. We have CAHA, calcium hydroxyapatite in the same category. We have PDO, some of the others, and I don't know, in the future we will have other molecules.
Yeah.
There are the very wonderful comparative studies that they compare all of these categories. I don't want to tell you now what is the difference between them.
But I think it's important that you included HA there, because a lot of people don't think of that as a biostimulator.
This is the things that I quarrel with, because me and Marin Alondo, my friend, big friend, all the time on the stage, we remind them that according to all of the literature, HA is one of the very good biostimulators. But the difference is, later I will tell you, we have negative and positive biostimulators, and I explain you later. So the second category is still liquid, but non-injectable. What is it?
Topical.
Peeling.
Yeah, okay.
Yes.
Nobody can tell me that a phenol, it is not a biostimulator. You change totally the face of the patient. The third category is the solid biostimulators, the absorbable threads. You put something on the skin, they absorb, and till the end of their lifetime, they can stimulate, the fibroblast and also the human adipocyte, because we put them in the human adipocyte, and all of the people, they forget this. The fourth category is the, mechanical biostimulation. Yeah. And there are a lot of, publications that when you vibrate the fibroblast, they stimulate to have the helix of the collagen and the production of the collagen. And the last but not the least is the energetic biostimulators. Energy-based devices in 4 categories, based on light, lasers, LED, IPL. The second is based on sound, so ultrasound, HIFU, high intense focus ultrasound, or shockwave. Yeah. The third category based on electricity, like radio frequency. Yeah. And the last one is plasma. Now it's very new, but there is no big evidences for that, but they can be. And now I come to the cellular scaffold. The cellular scaffold, and the top is the polynutriments, collagen fragments, PDRN, and so on. You give some scaffolds to the cells to use them when they are stimulated. Yeah. It means that when you stimulate the cells without giving them the cellular scaffolds, it means that you invite a Michelin 3-star, cookers, and your refrigerator is empty.
Yeah. No ingredients.
They can do nothing. You need to give this scaffold, and if you know my dear friend Dr. Shino Bey.
Yes.
Shino, for the first time, he really invites me for this thinking, and he came to me, Ferial, please let me know what happened to the skin of my patients when I mix the kaha with the polynutriments. And this is really a revolution, happened, just before COVID, and then we continue to work after COVID era. And so I come back to the positive and negative. What is the difference between HA and the others? I start with the negative. The negative, it means that you kill something in the skin, you destroy something, and then the cells, they will be encouraged to do something. Yeah. For example, when you do phenol, for 1 month, the skin is awful. Lasers, red, inflamed, dry, and then it started to be better. And some of these biostimulators, the same. They inject, inflamed, and then do something. Some of them, they are positive. From the start, they start the biostimulation, like HA. Mm-hmm. It is not aggressive to do the negative biostimulation, but they start to do something after. I was clear?
That was very clear. Wonderful.
I opened the
Pandora's box. Yeah.
Doors, yeah.
Hey guys, we've got another IA offer or promotion for you. We've partnered with Bacteriostatic Water Australia, a trusted supplier used by many clinics for their lab-grade bacteriostatic saline as well as water needs. Their products are manufactured to strict quality standards and are reliably packaged, and they offer fast delivery. They also ship internationally, so whether you're in Australia or overseas, you can access a consistent and reputable supplier. IA listeners get 10% off all orders simply by using the code IA10. To access this offer, click the link in our show notes.
So, because I'm a layperson, I'm not a doctor. So for me, I guess I'm talking on behalf of patients potentially, or people that need to work out how to explain this to their patients. So, bioremodeling, biostimulation, what is the difference?
This is a good question. When you do the biostimulation, bioremodeling happened later.
Right.
Because this is something you stimulate and something happened later. So the skin that is awfully like that will start to be remodeled. And this bioremodellation, and you know, I can tell you, this is the business and also marketing terms that the people use. If you want to be scientifically, you know, clear, it is the biostimulators that they do the collagen remodeling, and this collagen remodeling that is a wonderful component of the skin. And I tell you that, I don't know that you know, we have around 28 types of collagen in our skin.
Yeah.
Yeah.
And it's 28, 90%, 90. I repeat, 90% is collagen type 1 and 3.
Yeah.
But why the others, 26 others, what they do? They help to have these two components, collagen type 1 and 3. And this collagen type 1 and 3, they are in different layers of the skin. The type 3 is thinner, and they are more superficial, more fragmented. And the type 1, they are deeper, more, you know, very powerful, and they are for you know, firming. So the elastin fibers are also, they are very important. And all of them, they are in an ecosystem.
Yeah.
This ecosystem is like a pool, and this pool, it should be liquid.
Yes.
Can you swim in a gelish area? No.
Not easy.
Very slow. Very slow.
so during the aging, my friend, what happens? A lot of phenomenon that we have in the skin, but the problem is this extracellular matrix, it became gelish, not very liquid. And we need to hydrate it and hydrate it and hydrate it, because the immune cells, they cannot move inside. And if something happened, you know, the risk of cancer, skin cancer, is increased. So as a biologist, I tell you that all of the parameters that put the skin in the danger of the, you know, the stable aging signs, the same parameters, they put a danger to the skin cancers. So as a dermatologist, I tell to my patients, I'm not a hairdresser, I'm not a beautician, I'm a doctor. I'm responsible for the health of your skin, and the beauty, it comes automatically after.
Yeah.
Yeah.
So this is the things that every day I try to transfer in my trainings to doctors, to my patients, to all of you know the lives and everything that I have for helping them.
Yeah. So you're treating the cause, not the symptom. So by making the skin healthier,
exactly,
you get into the root cause of the symptom.
Exactly.
Yeah.
And because of this, I use the very high-tech imaging system. I do the photography for the patients, and I show them the level of inflammations that they have. And this inflammation is for, first, irradiation. Second is dehydration. So if I can tell you that this is three very important things that we should do, it is first, sunscreen, sunblock. Second, hydration. And the third is cleansing. Yeah. Because we have the debris every day on the skin, and then we can add the other things. These three can help us, you know. And all of my patients, they ask me the secret of my skin. I have 54 years old, but you know, without doing a big things to my skin, only I do this from the age of 25, 26, and the prevention is very important. So I encourage the young to do that, and treating the youngs is very important. And because of this, in my clinic, we have a young club. Yeah. And this young club, you know, the young people, they don't have money. So we encourage them to realize that what is the importance of the prevention. Yes. And then they give them some discount for having the preventive treatments.
Yeah. That's great. The other thing that our audience won't know about you is you're an expert in skin analysis, I guess. And you just touched on your photography and what that shows. So keeping it simple, what do you have in your clinic that actually looks at the skin?
You know, because I'm the editor of one of the biggest textbook on that. It is more than really, without exaggeration, more than 20 years that I'm in this field. And you know that all of the skin parameters change, even in a circadian rhythm. Yeah. You have the changes in hydration of your skin daily, in the daily rhythm. So we can measure everything like the hydration level, pH, you know, sebum, you know, the elasticity. We can have, you know, measured also the surface of the skin by the pore size, by the inflammation, redness, the color, you know, the homogeneity of the skin, and so on. So there are thousands of the parameters that we can measure. Even, for example, how much you're the sweating you have per minute, the transepidermal water loss, because we lose normally the water content because, you know, we are in the uterus of our mother. We are in a liquid.
Yeah.
After birth, we are in a dry area. So we lose water, and this losing water, that is transepidermal water loss, is hidden. We can measure it, and by aging is increased.
Yes.
If you have an injury on your skin, inflammation is increased.
Yeah.
So we can keep this very wonderful stratum corneum, the barrier function, and also the lipid layer of the skin to protect it.
So how do you measure that, or how do you recommend that listeners who have got a clinic, they don't have millions of dollars, what equipment should they be having in their clinic?
You know, unfortunately, it made me sad to tell that, because in when the clinics, they are very successful. They have a business developer there that they calculate only, you know, the
return on
cost
investment,
benefits, and they want to have the more than money in a you know, shorter time.
An exchange from product to result.
Yeah,
That's it.
But you know, my own approach is the first consultation is the most important thing. And this first consultation, it is about 45 minutes to 1 hour for me. And then after this consultation, that I measure everything for them, I give them an evaluation of 5 years. So they know that this program of 5 years, they need what in the wintertime, in the summertime, so and also the budget. So normally they do that because, you know, the aesthetic dermatology, what is it? One influencer or one, for example, celebrity speak about the, you know, vampire lifting. All of the people, they start to call the clinics to have this PRP.
Yeah.
This is not correct. We need a program for that. And in front of us, they are the healthy subjects. It means that they are not the sick persons, and they are not the patients. So we should discuss with them. We should decide according to the pre-authorized. For example, I tell them that, you know, you have, for example, the pigmentary disorders. You have also inflammation. You have also dehydration. I should start with dehydration. Then I go to inflammation, because this is the health of your skin. If your skin is not rehydrated, the effect of the laser is low.
Yeah.
The effect of HIFU is low. If you do the surgery, the healing is very bad. So we need really to work on the physiology and biology of the skin before doing anything.
Yeah, such a good point. The skin needs a fertilizer before it's going to...
Priming.
Yeah, exactly, priming.
We need this priming. And this priming is very individualized. For example, even for the ethnic groups is different. For example, I give you some example. You know that we don't you know, judge the skin now according to the color, according to the phototyping now.
Yeah.
According to the Professor Fitzpatrick many years ago, we have 7 phototypes from 0 to 6. The 0 is albinism. The phototype 1 is the Scandinavian countries people that never they can tan and always burn.
Yeah.
So by this way, they have the blue eyes normally, you know, they blonde hairs, but the reaction to the sun is very important. The second, the phototype 2, is the European one that they can tan, you know, like you, I think. The third is me. You know, normally the people that they have the color skin is not very, you know, matte, but they have the brown eyes. We can burn and we can tan also together. The fourth, they are the people that they are the more matte skin. The 5, like Indians.
Yeah.
And the black is like Africans.
Yeah.
So the 6 one, the phototype 6. So each of these phototypes, they have the characteristics. For example, the first one, because of the lack of melanin, they can break very easily. So for example, a 38 years old, you know, phototype 1, Scandinavian people, the wrinkles is like, for example, I don't know, 50 to 55 phototype 4, because they break very easily. Yeah. And on the other side of the spectrum, for example, we have the phototype 6.
Yeah.
They have the very grazy skin. The risk of the keloid is very high, hypertrophic scars. And for each of them, we have their own concern.
Yeah. Yeah.
Back to my question.
Yeah.
Because we didn't answer it. What equipment do you have in your clinic to assess?
So I have all. It means that I have the devices that I can measure you know, the hydration level, the sebum level, the transepidermal water loss, elasticity, different levels, hydration also different levels, stratum corneum, epidermis,
So
and
it's
also
not
dermis.
one device, it's multiple
You
things?
can, because there is for encouraging, because I do a lot of research also.
Yes.
For the clinics that they don't have to do the researches. For example, it is not an advertisement because it's very no conflict of interest, because we have two leaders of these machines in the world. It is the Collagen Kazaka in Germany and Delphin Technology in Denmark.
Right.
So the people, they can ask them and they buy. They have the devices that they have done for the clinics, not for research.
Yes.
So they are very easy. There are some parameters in. You measure your assistant.
Yeah.
Do that, and this is a very nice report. You know, come
I've
out.
heard of those ones, have you?
No, haven't.
And the people, they come. Normally, my patients, they come in my office. The assistants, they do the photography before, and also this measurement, and I can judge and I can explain them that, you know, what happened to your skin. And later, when after 3 months, 6 months, 1 year, they come back, we redo that, and we show that, okay, this is resolved. Now I can concentrate.
Keeps it objective, not subjective.
So this is really, for me, quantification is very important.
Yes,
because it is every eyes is different. You can judge, you know, for example, for somebody that is, for your eyes is very, very old, it is not the same for me, you know.
Yeah.
So it is not subjective, it really is objective.
Yeah.
And I try to transfer it for all of my training courses to the doctors, that you should invest in some devices like that.
Yeah. What would be a rough budget for this piece of equipment?
It is not very expensive. For example, for having a station that it can measure, for example, all something around 5 to 10,000.
Okay.
And there is no consumable.
So we're talking about 5 to 10,000 US or euro?
US dollars or US dollars.
Okay.
Yeah.
Cool.
Hey guys, sorry for the quick interruption to your podcast, but David and I know that being an injector and a business owner can be a challenging and sometimes lonely journey.
And it's not always easy to know where to turn to for trusted advice and genuine support.
There's a lot of gatekeeping and negativity out there, and that can make it hard to upskill and also access reliable information.
We also understand how important it is to have a positive, supportive community around you. That's why 3 years ago, we launched our own private online education community.
Yeah, we wanted to create a safe, uplifting space where injectors and business owners can learn, connect and grow, both clinically and in business.
And since then, our community has grown to over 2,000 international members, from highly experienced practitioners all the way through to those that are just starting out in their careers.
So if that sounds like something you'd like to be part of, you can find out more and join by clicking the link in our show notes. Now let's get back into the podcast.
Now, you also mentioned the word priming as opposed to biostimulation. So what sort of things do our listeners need to think about in terms of products, or how do they do it, or the approach?
The first is the cosmeceutics.
Yeah.
You know, the people, they think that, and I heard this question, my cardiologist friends and, you know, the neurosurgeons, that they are the pure medical persons. Ferial, this is a charlatanism. It is not. Really, it is not. I do not encourage the people to go to the expensive products. You know, the cosmeceutics, they are the cosmetic pharmaceutics. The term is created by Dr. Klingman and Professor Howard Maybach in US. But this is true. You know, there are the very, very different brands on the market that they do that. They do the very nice, studies to prove before and after, for safety also. So we should keep it all the time. What is it? Normally, as I told you, I do, and I prescribe 5 products per day. 1 for cleansing, 1 for sunblock, for irradiation, and then 1 is eyes, because you cannot put everything that is on the face or on the eyes. And these 2 remaining is 1 for day and 1 for night. Why different products in these 2 parts of the day? And a night is the regenerative part of our life, because of the physiology clock, like nature. So there is no pollution, no stress, no radiation, no makeup, and this is all of the content of the blood is under the skin. So it's the best absorption time, and we can focus on the problem of the skin. Contrary, in the day, we should defend. And defend is not only UV radiation.
Yeah.
It is also the stress, the pollution and everything. So the product that we give during the day is for the defense of the skin. So these 5, they're important. Normally, we should repeat it every 3 to 4 months. And, you know, normally my prescription is around $200 for 4 months.
Yeah.
So it is very affordable.
Yeah.
Why 3 to 4 months? Because the quantity of the cream that you buy, it is like that. And if you put the good dose, normally it is around 4 months. Maximum for the tiny faces, 5 months.
Yeah.
And we can adapt it to the season,
Yes.
to the response of the patients, to the change that they have in the hormonal, reactions, and so on. So every single time I reevaluate, I ask the questions and we renew. Sometimes the people, they don't have time. I do the visio.
Yes.
This is a prescription. Tell me, the last time it was that, please let me know what happened. No, doctor, is a tingling like that. This is very good. It's dry or not. So I change it. And every time I tell them that your skin and your cells, they are sleeping.
Yeah.
I re-awake them because do not forget that in front of us, my friend, there is a living organ.
Yeah.
And the adaptation is very rapid. If you put a cream after 6 to 7 months, it became really inactive because there's a big adaptation to your skin. So we should break this adaptation every time.
Right.
So sometimes I see my patients that there is an offer for the products, they buy 20, they buy 10. And I told them that no, you should not. So you should change it, and every single time that they change the products, they can see the change, the reaction, and these reactions show that the cells, they are reacting. And when they tell me that, doctor, I have a, like something like tightening, something like dehydration, I'm very happy. The cells, they are reacting.
Yes, it's working.
Please wait for 1 week. It will be good. But if there is exaggerated reaction like allergies, we will change it.
So presumably you meant vitamin C and a retinoid?
Everything. The molecules, they are different categories. For example, for aging, we have different categories. The head for gold standard, for example, is retinol and derivatives.
Yes.
Vitamin C as a very good antioxidant and depigmenting agent also, but do not forget, my friends. Nowadays, there is a very big tendency of layering, like the Korean approach, Korean products. And this is something that the people, they think that the Korean skin is good because of the Korean products. No.
Genetics.
And hiding from the sun their whole life.
So I would like to alert you and your audience that, for example, vitamin C, if you put more needful, you transform the effect from a antioxidant activity to a pro-oxidant activity.
Okay, that's not good.
That's not good. The second thing that is important, we know that vitamin C is good for the skin, but why we do not put the orange on your face? Why?
Can't be absorbed.
The first, absorption,
Also,
stability.
Yeah, it's because oxidative stress breaks, kills it,
Potency.
Third, safety. Allergic reaction, because we don't know that what is else in this orange.
Yeah.
And this is the things that there are also some tendency now that we do the botanic, we do this very natural things. Everything that I eat, I put on my
Yogurt,
face.
honey.
No. And we should avoid the personal result.
Yes.
Personal experience is not important in human experiences. We should do the very framework studies with the good calculation of the number of the subjects to follow the safety and also the efficacy of the products.
Right.
And please respect the companies for that.
Great advice. So along with Cosmeceuticals, in the priming, then we come to injectables and other products.
Yeah.
So just break down that framework for our listeners.
Yeah. Normally, I start with the cosmeceutics. This is the first step, then hydration of the skin, and then eliminating the inflammation. By this way, I can go more with the devices that the people, they pay for that, because we should have the win-win really relationship. So cosmeceutics, now. Hydration, I use a lot, the non-cross-linked HA injectables, because even you use a very good, quality cosmeceutics, they cannot penetrate to the dermis. So we should help to this penetration by mesotherapy products, polynutrient products that we can inject in the skin, and then the skin is now ready. And now I remove the inflammations by some vascular lasers, because I can see by dermoscope also we can see the cuprosis and sometimes rosacea and everything that erythema that on the skin. Remove it, and now the skin is ready, because this erythema can absorb also the energy of the lasers. So for the lasers, we need the chromophore of water to be penetrated. For the radio frequency, we need the water for the energy to pass through. For HIFU, we need the water. So when we hydrate, the efficacy of the product, the energy-based devices is better.
Right.
Fantastic.
Excellent. So, NCTF.
And other products.
And other products. There's so many products on the market now. It's becoming confusing for everybody. I heard a lot about NCTF from a lot of our recent guests.
I guess, and I want to get your take on this. People would tend to use things like NCTF or exosomes or polynucleotides as, I use the word fertilizer, like some sort of juice to help the skin optimize itself.
It's right.
Is that
the fifth category of me. The name is Cellular Scaffold.
Right.
I told you before.
So
all of them, they are in this category.
Okay, so how can people get their head around, why should I choose one, or why should I choose the other, or do I combine all of them? Like, just give people a framework.
Very smart question. I come to NCTF because only to give you an idea what is it, and really I would like that you put aside, it is not because of the conflict of interest, because this product is created in 1978 by a biologist doctor, Michel Torgman, and he's alive. And I love that one time that you come to Paris to speak with him.
Yeah.
So Michel, he has done a lot of study in 1978 on the human placenta and embryonic cells, and he didn't know that the name of the cells is stem cell at that time. And as he works a lot with the cell medium, because you know that for keeping the cells alive, we need to put them in a medium. And this medium, it should contain vitamins, amino acids, antioxidants, etc., etc. One day he asked himself, if I inject this sterile cell medium to the skin, what happens? And he realized that it's very good. The parameters of the skin change. So he changed it, removed some non-needful products and ingredients, and he named it New Cellular Treatment Factor.
I never knew it was called that.
NCTF. And then he put 135 because the first study that he has done on the human primary fibroblast increased the proliferation by 135%.
Wow, okay.
And then even now, at this moment, with the very high technology, I have better results. It's 250 something.
Wow.
We kept this 135 as a historical, approach of Michel Torgman.
Yeah.
So now I will tell you, the other products, they are a part of this polynutrients and cell medium, because this cell medium is contain also nucleosides. And sometimes the people, they mix them together because the vitamins that are inside, they are not in PDRNs. Normally, I encourage the doctors to use alternatively because, for example, a package of NCTF is 3 per year, for example, spaced 3 to 4 weeks. And then they can add another treatments to have the results. The exosome is another category that nowadays there is the big evidences for that.
Yes.
And these are the topicals. I put them in a Cosmeceuticals products because the topicals, you can benefit by penetration by some, for example, the rollers, lasers, and everything. It's like a cosmetic that you put, and the ingredients, look at the ingredients. There is not a bigger proof that these exosomes, they are, upper, and superior efficacy than if there is a cream containing these ingredients.
Yeah.
So if the result is good, no safety issues, we can continue to use. Why not?
Yeah. Am I right in saying, I don't know if it's different in other countries, that NCTF is only on label for topical, or can it be injected?
No, it's injected.
Right.
It's only in some countries they are doing their job to have an injectables. There are few countries that they do only topic. It is Australia.
Yes.
It is China at this time. It is US. And Canada, and the other countries, and Korea, I think, and they are developing because for as a medical device, as it contains 60 ingredients, it's very difficult for the health authorities to show them that this is not a medication.
Yes, it has to be a single ingredient to prove it.
So exactly, and so in 60 countries there's injectable.
Okay, it's just our experience
60.
where we thought it was off-label.
60 countries,
Right. Okay.
the injectables, and it is really, it's something that some of my patients, they come after the summertime vacations, and they enter to my office and they ask me that I need NCTF, look at my skin, because it's awfully, burned,
Sun damage.
inflamed, dehydrated, and something like that.
So how would you describe simply what does NCTF do once it's in the tissues?
Give a very nice ecosystem, hydrate the extracellular matrix, also calm down everything, because during my journey in field med, sometimes I have some data that has shocked me. In 2020, I received the publication of the Russian team, a Russian group of the professors, for treatment of vitiligo.
Oh wow!
Right.
I shocked. You can see this publication on the PubMed. It was shocking for me because all the time, all of my proof, it was for decreasing the photoaging effect.
Yeah, right.
For the pigmentation. So after a lot of discussion with, for example, a lot of people, we realized that these products put the cells in a very, very normal situation. So if there is an hyperactivated cells, they calm down. If it's the cells that they not do their job well, they go to the normal.
Yeah, right.
normal. So this NCTF, and we don't know the exact mechanism, because several times we try to remove one or two ingredients and the total product is changed.
Right.
So we don't want to really to touch it. From 1978, it is 47 years, it is the same and same and same.
And so from that, and I've also got experience with polynucleotides and Profilo, I wonder whether they work better when there's an actual wound or an issue that needs healing rather than just skin improvement.
The story is that I don't want to mention some special products, but I give you in general. We need hyaluronic acid as a important component of extracellular matrix to be hydrated, because it's four mechanism for HA. The first is hydration. The second is fibroblast stimulation. The third is they work like a sponge for the microcirculation. And the last is filling effect. And this filling is a mechanical effect also for the fibroblast stimulation. What is the difference between the different products on the market for HA? This is the story of their mechanism of action in the tissue, because we have two things. We have a very strong hyaluronidase, endogenous hyaluronidase in the tissue. We have around, can you guess how much HA we have in our body? We have 15 grams, 1.5. It means that 750 syringes of 20 milligrams, okay? So this is the total. 50% in the skin, 50% in the other connective tissue, including the eyes, vitreous gel, and also the joints, okay? Guess how much of this hyaluronic acid is destroyed per day by hyaluronidase?
Oh, most of it.
No, it's exaggerated. It's 30%. It's 5 grams per day. And this 5 grams per day is remodeled and recreate and restore.
It's like every 24 hours, right?
Every 20 to 48 hours. So the story is this rate of destroying is keep till end of our life, but the rate of restoring is slow down.
Yes.
So we lose 1% per year, 10% per decade.
Yeah.
And this is the story that we can restore it. The different products on the market for resisting against the this hyaluronidase, they do a lot of job to stabilize it. Sometimes heating, sometimes they do, for example, some molecules for that. The story is each of them could be inflammatory. Yeah. And the second thing, the secret is the molecular weight of the HA that they use. The low molecular weights, they are pro-inflammatory. There are a lot of publication for that and proof, scientific proof. And the high molecular weights, they are anti-inflammatory effects.
Yes.
So two different products with the same quantity, the tisular effects are different.
So do you think with our cross-linked fillers that as they're broken down over time and they turn into smaller chains, that they become pro-inflammatory?
This is true. If the products, it is not cohesive products, they fragment.
Yes.
And this fragmentation, they change them to the low, molecular weights, and they are inflammatory. And because of this, for example, after COVID era, a lot of cases they reported in literature that they injected 5 years before.
Yeah.
They do the vaccination, 48 hours after, they have an inflammation of the skin.
Yeah.
Because of these fragments. This is the low molecular weights that exist in our body. Can you tell me that HA is a temporary filler or a permanent filler?
Wow.
I tell my patients they're essentially semi-permanent.
Semi-permanent.
Yeah.
Semi-permanent because you believe that we have temporary, we have semi-permanent and permanent.
Yeah.
What is the permanent category? Can you give me an example? Silicone.
Exactly. Like
Semi-permanent is like biostimulators, CAHA, PLLA. And HA, it can be for you temporary or semi-permanent.
Yes.
I can tell you that HA can be temporary or permanent.
Right.
You know why? It's depending on which layer you inject.
Okay.
If you inject in the fascia, it can be with you till end of your life, because this is a blind area.
And it can't be attacked
and all
by
of the
Hyaluronics.
delay, there's a very nice publication by my friends Leonie Schelke and Peter Wiltius on 200 delayed, non-inflammatory nodules. All of them, they injected in fascia. If you inject in fascia, it can remain. And you may know Jan Trockel.
No.
From Wylift. He's a very famous, doctor in US. Many years ago, he was on the podium with Dr. Oz 15 years ago,
right. Okay.
and he showed that if you inject the HA on the bone, it can remain, lifetime.
Yes.
You don't need to change it because this area is trapped the HA, and this trapped HA can remain. But if you inject it in subdermis,
Yes.
several months after, you cannot feel it.
I mean, the issue is, it gets more technical because you think you're on the bone, but because of the needle track, it comes back up to the surface. So you don't even know where you've put it, and this is where ultrasound
And this is the
comes.
technique. This is the technique that
Yes.
how you put your cannula in an area that is flow back, it is decreased.
And also the speed of injecting and the size of the bolus, it gets very technical.
Speed, the product, type, the size of the cannula or needle, all of these, they are the parameters that you can change the scenario.
Right. I gave a talk yesterday. It was sort of cheekily entitled, "Do you think hyaluronic acid fillers are finished?" Which my answer was no.
No.
But where do you think we're going with injectable products?
I will tell you. Unfortunately, we have nowadays we have the hyperfill syndrome. What is the hyperfill syndrome? The people that they go to the doctors, and the doctors without putting an ultrasound small machine on their face to see that the hyaluronic acid is still here, they re-inject on top of this part. So I put it aside, but for the indication of the fillers, HA fillers and biostimulators, I tell that the biostimulators, when you want to have the volumizing effect, but general one, not pointy, we should use this type of products. The second, HA, for the point, and sharp projection.
Yes.
Never you can do the biostimulator on the nose, on the chin, on the lips, jawline, here, temple. So I do the biostimulators here to have, the regeneration of the adipose tissue. The first PLLA, it was for the AIDS lipodystrophy. They use it a lot. And now this is the same. You have the volume loss by, gravity and for everything. And then we can inject it, for restore all of that we lost for many years ago.
And where are we going in the future? What new materials do you think we might use? Do you know of anything coming?
I think that the polymers, we will go toward the polymers. Maybe in the future the injectable exosomes, but not these existing exosomes, because two very big persons that they are one from Mayo Clinic, Dr. Atta Beffar and Professor Ash Musabi from UCL, that all the time 1 hour they speak about the exosomes. At the end they tell that they are not the exosomes. Do not inject it.
Right.
So in the future, maybe we can have some true exosomes. What else? The energy-based devices, all the time, they can help us. Day by day, mixing hybrid lasers. They're very new.
Yeah.
Recently, I used one of them, thallium and erbium glass. It's fantastic. And what else? What else? I think that this is all.
Yeah, fantastic.
And the future, and we know that at this moment that the best things is a combination.
Yeah.
By the sandwich technique, you can help the cells to be stimulated. And please, my friends, the audience of you that they are my dears, do not follow only, for example, the people that they're not educated in these things. They need to follow the experts. It's breaking heart for me that, for example, if I do something in my Instagram or some specialists, for example, it's maximum on some thousands of follow. But somebody, I don't know, the people, non-educated people, millions of people they follow and they see, and this is the problem.
Yeah. Well, that's why we showcase people like you. So thank you.
Thank you
so
for
much.
you.
We're going to have to get you back because we only scratched the surface there, and there's many other things I wanted to ask you, but because of time, we'll wrap it up there.
I'm here
thank
for
you
you
again.
Thank you
You're
so much.
welcome. Thank you for this invitation.
Safe travels home.
We hope you enjoyed that episode, guys. To stay up to date with our latest news and episodes, follow us on Instagram, and we're now on TikTok.
You can also now watch our full video episodes on YouTube and Spotify. So if you like what we do, please give us a like and subscribe. Please also consider joining our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, hints and tips videos, bonus podcast content, and more.
All of our social links, Patreon, and contact information are in the show notes below, and we'll see you in the next episode.